Hello, and welcome to this session on GiveDirectly's emergency cash response to COVID-19 with Rachel Waddell. Following a 10-minute talk by Rachel, we'll move on to a live Q&A session where she will respond to your questions. You can submit your questions in your name or anonymously using the box to the right-hand side of this video. You can also vote for your favorite questions to push them higher up the queue. We'll try to get through as many as we can. Then after 30 minutes of questions, I'll bring the Q&A to an end. But that's not the end of the session. To help you think through and apply the ideas you've heard, I'll be asking you to join a 20-minute icebreaker session where you'll have 2 speed meetings with other attendees to discuss your thoughts on the content. I'll explain how to do that and when we get there. But now I'd like to introduce our speaker for this session. Rachel Waddell is Partnerships Director at GiveDirectly. She joined GiveDirectly from the Overseas Development Institute, where she was head of strategic partnerships for governance and climate change. Prior to this, she worked on climate change and sustainable development with the New Climate Economy, the Global Green Growth Institute, and the UK Department of Energy and Climate Change. She holds a BA from the University of Nottingham and an MA from the University of Leeds. Here's Rachel.
Hi, my name's Rachel Waddell. I'm Partnerships Director with GiveDirectly. I'm really excited to be speaking with you today and to have the chance to share with you some of the rapid response work that GiveDirectly's been doing over the past couple of months in the light of the COVID-19 pandemic. And we'll take some time today to first off look at why cash has emerged as a kind of critical tool in the COVID-19 response, to then dig in on our Uganda program, which is one of the first ones that we launched, and finally to take a step back and to share some of the key challenges or the key questions that we've been grappling with this and what they might mean for the sector more broadly. So sooner or later, as we know, coronavirus will have, and in fact nearly has, affected every community around the globe. Perhaps there's no other time in history we're all in it together. However, we also know that COVID-19 is disproportionately impacting the poorest and the most vulnerable, both through direct health and secondary economic impacts. And this is going to hit especially hard across sub-Saharan Africa. The World Bank has estimated that the pandemic will plunge the region into its first recession in 25 years. And across the countries in which GiveDirectly works, the poorest are already feeling the impact from government restrictions on movement and commerce. In Kenya, the first country in which we launched a COVID cash response, recipients that we've spoken to have reported pretty sobering statistics. 94% of those interviewed have seen a reduction in income. 68% have reported that they have no choice or will go to work anyway for income. And 92% have needed to reduce how much they eat. These stats are echoed across the countries in which we're working. And it's clear that the situation calls for immediate action and action at a vast scale. Without rapid support, households will inevitably be forced to engage in negative coping strategies. So to take on debt, to sell assets for survival, and the impacts of this will last far beyond the COVID response measures themselves. So in this context, the Centre for Global Development, amongst others, has called for rapid scaling up of cash transfers to address this emergency. Governments across the world are following suit. Social support programs are now being put in place or expanded across about 106 countries, with cash transfers central to this and representing 65% of these social assistance schemes. So why is cash emerging as such a critical response? We all know the fundamentals by now. Cash interventions are backed by a rigorous evidence base that shows pretty consistent positive outcomes across nutrition, education, consumption, assets, incomes, and other indicators of well-being. As a COVID response in particular, some of the most pertinent evidence around cash is that it supports markets. So it allows individuals to make the choices that address their priority needs. It avoids creating market distortions, avoiding the challenges posed by in-kind distribution of oversupply of particular goods, which further erode the incomes of local vendors and producers. And critically, it supports local economies. So a recent study done on one of GiveDirectly's programs in Kenya showed that for every $1 of cash delivered, you could see a local economic multiplier of 2.6. Add on to this the particular advantages of digital cash. So again, as we know, and have seen across GiveDirectly's programs, digital cash is efficient. It also allows us to rapidly, securely, and in this context, even more critical than ever, remotely deliver cash to some of those most in need. That's not to say that we haven't needed to rapidly redesign our programs due to COVID-19. We have, and we've needed to find ways to target, communicate, enroll, verify and audit and follow up with recipients without meeting them, as well as deal with new risks associated with cashing out, with ensuring inclusion of the most vulnerable, and in reaching high standards of fraud detection without any in-person contact. So to look in Uganda in particular and see how this has been panning out. On last numbers, there were 450 confirmed cases of COVID in Uganda. As of March 25th, however, the country's essentially been in lockdown. Public and private, so bodas, transportation has been suspended and all non-essential businesses have been instructed to close. UNICEF did one of the early modelling exercises on this that indicates that unmitigated, the fallout from COVID could increase poverty rates in Uganda from about 24% to 31%. Household incomes are expected to fall, particularly among the existing poor, as well as those who are labour constrained or informal workers. And these impacts are being felt across Uganda, although they're particularly acute in urban informal settlements, where residents are renters, where they don't tend to grow their own food, and they are overwhelmingly likely to be employed in the informal sector. We've therefore decided to focus our initial relief efforts in urban and peri-urban areas. We are, however, maintaining a close watch on how secondary impacts evolve across the country and ensuring that we build in an agility, a flexibility in our programming to be able to respond as needed. We've adapted our usual programming. We've pivoted to remote home-based call centre operations, and we've increased the capacity of our call centre to take on tasks previously done through field officers through door-to-door enrolment. We've developed methods of sending mass SMSs to identified recipients to enable remote enrolment at scale. And we've had to develop new partnerships, new targeting approaches to identify those most in need. The two primary approaches that we've pursued in Uganda are through telco targeting and through partnership with local organisations or CBOs. We kicked off the programme through this remote pilot phase, building from a pilot we already had underway. So last year, we were looking at the possibility of using mobile phone usage patterns as a predictor of poverty, with the view to rapidly, remotely identify and deliver support to those most in need. From this, we've had an existing data set of up to about 6,000 adults that we're moving ahead and enrolling immediately. The development of the poverty prediction model is still ongoing, and there's significant interest in this as a remote targeting model. So we're looking to accelerate development of this to incorporate into targeting approaches if it's shown to be successful. Phase 2A, as we've described here, involves partnering with telecommunications companies. And we're doing this to obtain mobile phone subscriber data in known high poverty, high vulnerability areas, which are primarily informal urban settlements. These subscribers are then contacted via SMS and enrolled following receipt of consent. Alongside this and recognising challenges around inclusion and exclusion errors, we're partnering with community-based organisations to provide lists of existing vulnerable individuals, which can be ingested into the GiveDirectly system to start the remote verification, enrolment, payment and follow-up process. The scale of our COVID response goes far beyond what we have delivered to date. To give you a sense, over the last 10 years, we've delivered cash transfers to around 170,000 households. Now, in Uganda alone, we're looking to reach upwards of 250,000 recipients over the next 4 months. We're also launching similar responses in Kenya, Malawi, Liberia, Morocco, Rwanda, potentially the DRC, with a target to reach almost 500,000 people with a $100 million raise. Our top takeaways, therefore, around who to target, how to identify those people, and how much to give them. On targeting, our standard programme model of identifying those in the poorest areas, as selected through national poverty data, doesn't hold here. The most vulnerable to COVID are not necessarily the historically poorest, as borne out in the impacts we're seeing around rural versus urban households. We've also been faced with the trade-off between dispersing cash as quickly as possible at scale and mitigating inclusion and exclusion errors. Through our approaches, despite our best efforts, we will not be able to reach all of the most vulnerable. One of the issues that we're grappling with is whether we can find a way to reach those without mobile phones under the current restrictions on movement. On identifying and enrolling recipients, we can't go door to door. First off, we're not able to do this under COVID restrictions. However, aside from this, we would not be able to reach the numbers we're targeting within the timeframes that we need, driving response through a door-to-door approach. We're therefore piloting, testing, monitoring really closely different approaches, as I mentioned, through telco companies, through partner CBOs and local organisations, but also through closer engagement with existing government safety net programmes. Finally, on transfer sizing, again, for this emergency response, we've moved away from our standard model of $1,000 lump sum cash transfers. Emergency cash transfers for COVID response are sized to allow as many as possible to meet basic needs and avoid destitution. We don't, therefore, expect to see the same spend around livelihoods investments or asset purchases. And one of the key questions that we're discussing and evaluating in real time here is what the minimum transfer requirement is to effectively meet needs, to avoid destitution, those negative coping strategies, and positively impact local economies, recognising limited resource and the need to respond on a pretty unprecedented, significant scale. So I really look forward to hearing your questions and reactions to this. It's an unprecedented time for GiveDirectly as globally in uncharted territory for us. We're excited not only to deliver critical support to huge numbers across our COVID response programs, but also to develop and share insights on the use of digital cash as a key tool for ongoing wide-scale social assistance. Many thanks.
Thank you for the talk, Rachel. I see we've had a number of questions come in already, so let's kick off with the first one.
Great.
Well, the top two questions are kind of related. Also, I'll go with the second one. GiveDirectly's program for US-based recipients seems to run against previous reasons to donate to GiveDirectly's program.
Yeah.
Why did GiveDirectly establish it?
Yeah. It's a great question, and one, of course, that I thought would come up in this. I mean, the first thing to say is that GiveDirectly isn't sort of diverting from its core mission. Our core mission is still to work with those poorest around the world. And when we've done US-based disaster response before, we've had kind of lengthy internal conversations before we launched this. our thinking has been, I mean, the need for COVID support around the world is immense, including in the US. We've had an additional challenge with the COVID pandemic, that it's meant that we've needed to reorient our operational model. So had to do a pretty rapid review and reorientation of our operations that I'm sure most people know have generally involved door-to-door, in-person engagement, involvement, etc., etc. And as the pandemic hit and we paused our operations across all of our countries, the country that was sort of most ready for that operational shift was the US. So we were able to move there pretty quickly. Also, I think, I mean, the nature of COVID and the pandemic has meant that there has been an incredible, like an unprecedented amount of support flowing in, and people really wanting to do something. They're seeing the impacts of this in the communities that they're living in. They're seeing it in their own countries, and a lot of people were kind of, knocking on our door, wanting to provide some kind of COVID response. Looking at the stats that we're getting on the US COVID response, about 70%, currently about 70% of our funders for that are first-time funders. So we're actually tapping into like a new crowd of people that either hadn't heard of GiveDirectly or perhaps weren't fully bought in on cash as an emergency response. So we're not seeing any evidence that we are kind of converting funders from the international effort to the US effort, but more that we're attracting a new set of funders. And if anything, we're seeing quite a lot of evidence that people are converting, sort of being drawn to us through the publicity and the engagement and the celebrity endorsements, etc., in the US, and actually through that, learning more about our mission, learning more about the work that we do in Africa, and converting into international donors. So, like, it's certainly something we debate internally every time these things come up, and monitor pretty closely, and are very conscious of the fact that it's not something we want to kind of cannibalize from the international efforts. Having said that, we're seeing pretty sort of profound kind of impacts, getting good responses from our recipients for the US, and we're really cognizant that there's a huge need there, as well as the other countries that we're working in Africa. Yeah.
Great. Thanks, Rachel.
Uh-huh.
So I think, the other question was related, and it was framed in a slightly different way. Is it possible to make a strong argument in favor of donating to the COVID-19 US program rather than the Africa program? Yeah,
I mean, partly this comes down to a sort of personal choice. I think people are motivated at the moment more than ever to support in their kind of direct proximity. People are really seeing the impact of COVID close to them. I mean, if you look at, does a $30 donation go as far in the US as it does in Africa? No. I mean, it's true. So I think it's a sort of, is there a strong case to be made? It depends on what angle you're coming at with this. We felt internally that there's a strong case for going ahead and doing the program. Part of our mission, I think people know, is also, one is to get as much cash as quickly as possible, as efficiently as possible, to as many people as possible. But also there's a kind of top level goal there to try and shift the sector and really inform that. And I think some of I don't know, folks will probably have seen the press coming out about the US response. And there seems to be a real shift in how people are viewing cash as an emergency response. And I think I think that we'll see the impact from that be pretty transformational in the space over quite a long time. So clearly this depends on the angle that people are coming from. $30 doesn't go as far in the US as it does in Africa. However, we're seeing that those $1,000 donations in the US really are making a kind of tangible impact on people's lives at what's, undisputedly a really tough time.
Thank you for that.
Okay.
Again, on the US program, could you speak about monitoring and evaluation for this program?
Yeah. So I mean, again, across all of our programs through with the pandemic and the restrictions on movement that are in place, we've had to shift all of our monitoring and follow-up to remote-based follow-up using SMS, using call centres, but we are following up with recipients. There is an inbound hotline to capture, any issues, adverse events, as there always are through our programs. We just had preliminary results through actually late last night, so I'm not in a position to share them as yet, but they will be there publicly, on a much more in-depth survey with US recipients, so we'll be able to see all of that soon. I think some of the anecdotal stories are already up and about around that, so people will see, but we are doing a more kind of robust in-depth evaluation as well to really work out how that's impacting people's lives.
Great, so I think we'll keep an eye out for that.
Yeah.
Okay, the next question. Do you think lockdown in extremely poor countries do more harm than good, since it has delayed, the regular malaria or other interventions?
I think, this is it's a difficult question. It's a good question. It's an incredibly difficult question. We all saw that lockdown, certainly in the countries that GiveDirectly, or most of the countries that GiveDirectly works in, lockdown came much more quickly and much more severely than we've seen here in Europe. And there are any number of reasons behind that. Health infrastructure, the government's ability to cope should an outbreak really take off. Having said that, it's clear that restrictions on movement, in particular in urban areas, peri-urban areas, are having a pretty profound impact already on people's lives. I shared some of the stats, I think, from the Kenya program, but we're really seeing that across all of the countries that we're working in, that people have very limited savings. So very limited means to survive once their income is cut off. Most of the people that we're working with, again, in urban and peri-urban areas, they rent their properties, they don't grow their own food, most of them are getting their income from the informal economy. And so a lockdown has had really profound and very rapid impacts on their lives and their ability to feed their families and not kind of take on debt, sell assets, all of these negative coping strategies. You add to that, as touched on in the question, that it's the majority of kind of existing support interventions, aid interventions, have needed to be halted, at least to some degree, exacerbates those impacts, of course. And we, as GiveDirectly, have found ourselves in very strange times, in a sort of fortunate situation that we have been able to pretty quickly shift our operations to be able to effectively, safely, securely deliver support, actually on a scale that is going beyond what we've done before, despite those restrictions. And I think the sort of level of support and the scale that we've managed to reach with that is a sort of testament to it. But yeah, hugely difficult decisions for various governments, and of course, yeah, very, very difficult to know how severe and how widespread those lockdowns should be and what timing.
Great. Yeah. Thank you. Thanks for your response. So I think building on that restrictions around movement and the logistics of the current programs where it's remote allocation or remote donations, how did GiveDirectly overcome the issue of cash transfer for the unbanked or those without mobile banking in the context of markets like India?
Yeah, this is a great question, and one of the things that I think I'd mentioned. This is the danger of a pre-recorded talk that 3 days ago you forget your phrasing, but yeah, this is one of the real challenges. So, for example, in Uganda that I spoke about, the way that we're pursuing is the primary route of identifying significant numbers of highly vulnerable people very quickly and very efficiently has been using this through partnerships with telecommunications companies, so using this cell tower data. However, the glaring challenge of this is that if somebody doesn't have a cell phone, you're not going to pick them up. And what we've been doing is really building out partnerships with local organizations, so community-based organizations, grassroots organizations who are working with particular vulnerable groups to understand how we can reach those. There is a challenge without, if there are severe restrictions on movement, it's very difficult to provide somebody with a mobile phone or a SIM card or access to that funding. However, through those CBO partnerships, and some of those were still providing support at the community level, we're able to do that and to bank folks along the way that we usually do through door-to-door enrollment. But it is a challenge for sure.
Thanks for that. So I think zooming out from the COVID-19 response situation, based on GiveWell's selection of most effective charities, GiveDirectly ranks comparably low, last within the top charities. And why do you think that is so?
Again, interesting question. I think there's a number of things on this. I mean, first off, it's worth noting that GiveWell, it's inevitable in a sense that GiveDirectly is at the bottom of that list, because GiveWell uses cash as a benchmark to exclude any other interventions that don't kind of show that can't demonstrate that they are more cost effective than cash. It's not that GiveDirectly is at the bottom because there aren't giving options that are worse. There are. The other thing, the other organizations on the GiveWell recommendations are highly effective charities. So what we're talking about here in those GiveWell recommendations is a sort of total market share going to highly effective charities and their capacity for more funding within those. There's also this issue around moral weightings assigned to different outcomes through the GiveWell evaluation model. And unconditional cash transfers, necessarily there's a sort of challenge in that, because you're spreading out your impact across a number of different outcomes. And then I think the final thing is that there's a broader role for cash in the sector as a benchmark that I think is kind of necessarily undervalued in that ranking, where you don't there isn't an effective means of tracking how cash is kind of shifting the sector to be more effective by encouraging other interventions to sort of demonstrate that they are able to beat that minimum cash benchmark.
Great, I think that answers the question. Thank you. So the next one, how could the EA community support GiveDirectly? What expertise and connections could you benefit from?
We have a huge amount of support from the EA community and have done for numbers of years. And that support comes in a lot of different ways. I mean, I think one is like, we really value and encourage an open conversation and challenge around these things. I mean, the questions around the US COVID response, like keep them coming, keep holding GiveDirectly to account on this stuff. It is stuff that we think about really carefully internally, and the EA community has been, across the world has been like a brilliant thought partner in that, and that's highly valuable. Individual members of the EA community have supported GiveDirectly, both, pro bono advice or informal discussions on particular topics that we're grappling with. And of course, there's been a huge amount of funding support as well over the years, which is really invaluable. I think we find ourselves in really interesting times with the COVID pandemic, actually. And I mentioned in the presentation that the scale that we have reached through this pandemic is just unprecedented for us. it's put us into, we've been a roughly $50 million a year organization for a few years, and this is the first year that already we've exceeded $100 million, which is just huge. There's then a really interesting question about what we do following this. It's slightly different, as folks know, to our standard model where we would give large lump sum cash transfers. This is a different kind of disaster response model, and we'll do. At the moment, we are working sort of around the clock on delivering this aid, but there will be a really important period of reflection, I think, post-pandemic on what this means for us, where we should be working, whether we should be doing more in the humanitarian space, and really call on the EA community to like engage, send us your thoughts, talk to us, join the donor events, webinars, all of this stuff that we're doing, because it's a smart group and input is always really valuable.
Great, thank you.
There's something I haven't said there. Folks should email me. If folks have got in mind some support that they'd like to give or a way that they'd like to be engaged, then feel free to suggest that as well if we're missing a trick somewhere.
Absolutely. Thank you. And they can connect with you on Slack for that?
Sure. Yeah, of course.
Okay. Let me see the next question. Great. This circles back to the presentation. How representative was the survey shown in the presentation? How many people were interviewed? It done on a big scale. Yeah. Could you share a bit more? Great question. I think this is talking to the Kenya. I'm presuming this is the Kenya first slide. The early stats that we got on. Sorry, I'm just thinking whether there was another one. It was a fairly small sample group at the beginning. When we first kicked off the Kenya program, we did internal follow-ups. We're continuing to do this. So actually these stats change and are updated over time. We kicked off, I think the first survey that we did was with a few hundred, so a pretty small sample. We've now, we've reached almost 20,000 people in Kenya, and all of these metrics are kind of measured in real time. So those stats will change. It's an internal tracking tool where we follow up with all recipients from our call center. Either now, because of the scale, we're doing a lot via SMS, but we are doing sample follow-up calls from the call center as well, and we're tracking all of that. There are some others, I think, that loop in here that are done by other organizations, such as BRAC. There was a very sort of rapid, in the first few weeks of COVID, people were very quickly trying to get a sense of what's going on in the places that we're working. So some of those are fairly small, but it gives us an indication in what otherwise is a pretty tricky time to really work out what the secondary impacts of COVID have been. So in a way, it's an expanding sample size that we're talking about. Yeah, we're collecting that data in real time as we're talking to more and more people and as we're enrolling more and more people. Yeah, the percentage that we follow up varies a bit across programs and depending on the scale. So within each country, in Uganda, aiming to reach over 100,000 people, up to 250,000 and beyond, we'll actually look to follow up with 1% of recipients through a phone call survey, and that's just purely because of the scale that we're now working on. But it does vary a bit depending on the overall size of the program, yeah. Great, thank you. On the next question, what is the key idea you would like people to convey when talking about Give Directly? I think there's a few. Is that cheating? I think the primary thing is about using unconditional cash transfers to empower recipients to meet their own needs. This idea that the poor know better how to meet their own needs than others do, and they have proven time and time again that they can effectively meet those needs if empowered and enabled to do that. I think that's the primary message. Great, thank you. on the next one, since GiveDirectly's model is one-time cash transfer, does it mean people who got cash before are not entitled to the COVID-19 cash transfer?
This is a great question again. Because of because of the nature of the targeting, it's unlikely that they would overlap. One of the things I think I mentioned in the presentation is that it's a bit of a different demographic group. So our standard programs through GiveDirectly who receive the $1,000 lump sum cash transfers are in the poorest rural villages. For the time being, although we're monitoring really closely, our COVID response efforts are focused on urban and peri-urban areas, who from the data that we've been collecting to date, and the analysis that's out there, are those who are most affected from the COVID, from the restrictions on movement. If there, hypothetically, if there were, those wouldn't necessarily be excluded from the GiveDirectly program. This is intended as an emergency relief, 3 months, relative compared to GiveDirectly's usual transfer size of $1,000, roughly $1,000. Through these programs, we're giving roughly, again, it varies a little bit across country, but about $25 to $30 a month over a period of 3 months. That's really intended to meet emergency needs. There is also, quite frankly, something about wanting to maintain the highest efficiency rates. There is a lot of resource being pumped into this, but it's obviously insufficient to meet the scale of the need. And there is an element of needing to accept a kind of inclusion-exclusion error in order to reach as many as we possibly can, as quickly as we possibly can.
I think, yeah, thank you for that. So this other question is kind of related. Can you share some details of the indicators you use to determine vulnerability? Is it only from mobile money records?
Again, yeah, great question, and varies a little bit across different countries. I mentioned in the presentation one that may be worth kind of digging into here because it's pretty interesting. I mentioned this mobile data remote pilot that we had actually started pre-COVID. And it was intended as sort of, a pilot program that we designed intended to respond to, we were actually thinking about droughts, but to enable us with a way to rapidly and securely identify and get support to people in the wake of a disaster. And this is, we're partnering with Dahlberg Data Insights, and they're building an algorithm that looks at mobile phone data usage patterns and sort of uses that as a proxy predictor of poverty. We are still testing that. We're not actively rolling that out at the moment as a COVID response, but it's a pretty exciting, if that algorithm is proven to work, it's a pretty exciting approach. In other places, we're using a combination. Part of it is geo-targeting through cell tower data, so picking areas that we know are some of the poorest areas, informal settlements in particular cities, but we are overlaying that with information from local organizations, local CBOs, NGOs, with government data that looks at vulnerability and poverty. It's tricky, given this point that I raised right at the end, that a lot of those, a lot of the poverty surveys that were done pre-COVID don't necessarily pick up those that have been most impacted by the COVID-19 restrictions. So it's a combination of sources that we're using for that. And as I say, we're kind of building in flexibility and remaining agile within our programs to respond as that changes, and monitoring as closely as we can.
Thank you.
Great.
So I think we have time for just one last question. How valuable is lobbying state or national governments to try a full national or state level trial?
This is a great question. This is a hard question to answer in about 30 seconds. So happy to pick it up again. But there is a lot of government interest, in particular in our COVID response. And I think we find ourselves in a stronger position than ever before to really inform government strategies going forwards. A lot of governments, as I mentioned, are rolling out expanded or new social assistance programs in the wake of COVID. Cash is playing a critical role in that. And a lot of governments are looking to us to share learnings from the work that we are doing to inform that into their own programs. And, we are engaging governments really closely on that. I'll leave it at that, but I'm happy to follow up on that question. It's a long question, but yeah.
Yes, thank you very much, Rachel. I think that was a great point to end the conversation on.
Great.
And that concludes the Q&A part of this session. But for the audience, don't go away just yet. Discussing new ideas with other people can be a really good way to understand them. So we're going to use the last 20 minutes of the session for a couple of short speed meetings with other attendees. If you check the session description below this video, you'll find a link to an icebreaker session where you're going to gather for those meetings. So please click that link now, and a new host will meet you on the other side. Thank you, Rachel.
Thank you. Thanks, all.